The main challenge of brain health these days is data silos. I know that sounds really weird, but if you think about parable of the blind man and the elephant, we touch different aspects of the elephant, and in our not limited but in our specialized focus, it can get really narrowing as to what we focus upon. Technologies like TMS, for example, been around for about 40 years. It's not widely known, and yet it's so effective sometimes. I think about what we could potentially do if we actually worked right across the board and it was taught at med schools, and we realized that this was actually an option. The other aspects of that, so it's not just data silos and not just knowledge silos, but really access. So access to technologies like this, they're not super affordable. And even if they're on the MBS, can you imagine someone in country Victoria or rural Queensland being able to treat their depression coming into a centre like this in order to access technology like this, or even having the technicians that were actually trained for it? Totally possible, but most definitely needing things like government support or private funding, and that makes it really challenging. Some people would say, well, why wouldn't you then admit the patient, go into a hospital? The hospitals are there for that reason. The challenge is actually admitting the patient. There's life, there's dogs and cats and animals and family and kids and people to take care of, etc. I don't think that we've actually had anyone in our clinic that hasn't needed to stay at home or not wanted to go into a hospital. And that makes a premise like an outpatient clinic, like brain aid clinics, very, very important for people who are just making it work. Their life is functional. They're able, in order to be a good partner, be a great mom, be a great spouse, or take care of themselves, take care of their animals, have responsibilities. But if you should take them out of that environment, it becomes really challenging. And we know from research that patients actually integrate better back into their home environments if we actually treat them in a familiar environment. So for our purposes, brain aid clinics is here in order to serve people. I want to overcome that challenge in addressing brain aid in brain health, which is that maybe they don't have the latest access to the information or the latest technology, but it's available here.